I've been losing my hair for the last 5-10 years. It's been progressively getting worse, and so I decided to do something about it. Tried Propecia, Rogaine, kind of everything under the sun, and so now we're doing the real thing. So I'm getting married next year, but unfortunately with weddings comes photos, and so from my perspective I needed to do something about my hair in the meantime, and so I came to see Dr. Sean. A good friend of mine had come and seen Dr. Sean previously, had great results with what he did. At the time, I hadn't lost enough hair, and whenever a doctor tells you no, you're not allowed to do something, or not allowed to do it yet, it actually gave me a lot of confidence in that he was the right person for me to actually come to. And so been probably 5-7 years since I had seen him last, and so now I'm back and able to actually have the procedure. So yeah, getting the FUE done feels a lot more comfortable to me personally than the strip, doing 1,800 grafts from the back and then getting it done in the frontal region where you can see I do not have very much hair. I'm excited that I won't have a shining spot on my head during Zoom calls, I'll tell you that. I'm excited that my fiance is going to be excited on our wedding day for the actual photos.
Hi, I'm Dr. Sean Behnam, and thank you so much for joining us today. We will be doing a hair restoration. The goal is to focus on the hairline, right, which is right over here, and to create something that is natural, age appropriate, and dense, and something that frames his face. So you don't want to come down too much, but you want to create something that is very natural and really frames his face using FUE procedure. So are you ready, sir?
Yeah.
Awesome, let's do it. Okay, so I'm gonna go ahead and design where we want to go. Everything has to be basically done, all the lines, according to the framing of your own natural face, right? So this is about 8 centimeters. And I know you have hair that comes below it, right? But if you bring your hairline too low, it may not look natural in your 40s or 50s, right? And you're gonna overutilize a tremendous number of grafts, which I see all the time. So don't overdo it, keep it natural. So this is an art, so I continuously have to look at it to make sure it's framing your face very nicely. So the reason I do this is so that I can make sure it's on very similar planes, and that's important. So the first line I draw is on a straight line and in the same plane, right? It's symmetric. However, I'm going to break this up. Important things to realize, right, are as follows. I want to begin placing the grafts from where you're going to lose the hair in the next 2 years, which is basically somewhere around here, because I don't want you to be back here in 2 years from now, right? So we're going to basically start from there, cover this region as well. Now, I'm going to go for 1,800 to 2,000 grafts based on how dense I can make it. We may hit that line slightly above it, but that's okay. The important things for the audience are that the lateral parts, right, basically that go into the edges, the sides, are based on the lateral part of your eye, because that's how it's going to be natural forever, right? So you don't want to basically do something where the lateral part of the hairline comes here, because as you go into your 40s and 50s, it's not going to be natural. However, this triangle is very natural for guys and very age appropriate, and that's very important. And I love this diamond shape because it gives the best results for dense packing.
Cool. Is there any way to get a little bit lower?
Depends how dense I could make it.
Okay.
Yes. The other important thing to note is that as you go below this curvature, the skin really thins out and the hair follicles are longer than thickness of the skin, so the hair goes really flat on your face and hair restoration does not look natural that way. I have a way of actually readjusting the angle, but you don't want to overdo it, and this is very easily 2,000 grafts, so we're going to keep it to about 2,000.
Okay, cool.
basically all that area, which is actually a big area. Once it's filled in, it will blend in with your natural hair and look very natural. Again, the key thing is that the entire design is based on your own facial features, right? How fast you're losing your hair, family history, where you're going to end up in 10-15 years, what's going to look natural, not just today or next year, but 10 years from now. I mean, a lot of times I see a lot of people where they want their hairlines really low down to here, but this hairline down to here, where you know, where it was when you were 20 years old, right? Age appropriate for then, but not age appropriate for age 40, overutilize a lot of grafts, and also you're gonna not look natural. So, and I see a lot of these patients where they don't look good after a few years, right? So the goal is that we have to look at 10 years from now, make sure everything looks just fine. This is and I love this design. And so the height of the hairline itself in the front is based on your facial features, right? In addition to the hairline on the corners is based on where your eyes, the lateral part of the eyes is set. And because that's how people see as natural. So I like to do the shaving myself for many reasons. Most importantly, because I want to evaluate the hair and the grafts. My goal, my mission is to extract as many grafts with 2 hairs and 3 hairs as possible. If you shave everything down to the skin, you can't differentiate between 1 hair, 2 hair, 3 hair. So I actually leave about 0.45 millimeter of the hair to stick out so I could differentiate it. The grafts come out easier, better quality, and higher number of 2s and 3s. And my hair to graft ratio is higher, you get better density. So I test the spot first and then I do measurements. So my measurements are good, and then I shave it. I have already pre-marked the areas that I want to extract the grafts. I'm only going to be staying within the donor area that are good quality. All of these are very good quality. Again, it's not completely shaved to the skin. We don't want that. This way I could see which grafts are 1 hair, 2 hair, and the 3 hair. As you can see, I'm continuously evaluating, making sure that the haircut is good. I'm able to get the good quality grafts, and that's very important. The other reason that's important is because people have, so the actual hair itself may have a slight curve to it, and also their calyx, where the hairs go in various angulations and directions. So this way I'm able to identify and follow those curvatures very easily. This just took me about 8 years to figure out, that's all. So all this area is the safe zone. That means it does not show any sign of thinning. You will see there's a calyx here where the hairs actually change direction. And I could see it. I know that a lot of places like to shave the whole head. I don't like to. A lot of my clients are professionals, they need to get back to work soon. So I work around it, and it has worked very well for me. This is extremely important. A lot of times I see FUE done and the extractions are done on a straight line. That is a mistake, because once the scar actually heals, right, you could see the scars on a straight line. This is an art, and the way the edges must be done is in a zigzag pattern. So it confuses the eye, so nothing's on straight line. So none of the punches will be done straight lines, right? Everything is done in random patterns. Again, in nature, everything is random. The edges are the most important. So this way, he could cut his hair short and people's eyes can't really notice anything was really done. And that's actually very important. Okay, perfect. I have a bunch of lines drawn here. I'm going to do some more lines where we're going to numb. And then the last important thing is we're going to actually color. The coloring is very important, right? So it allows us, right, to actually see the hairs better, and also makes the hairs firmer so they come out nicer. So this is going to be a bit cold. There is a very unique way I do the coloring so it does not taint the skin. Now, do we color every case? No, but in your case, some of the hairs are lighter, and when we shine LED light on it, they become almost invisible. Again, the key is to extract as many grafts with 2-3 hairs as possible. Awesome. Could you leave on for 5 minutes, please? And important things, I do the haircut, I do the coloring, I do the extractions, I do the numbing. These are important. This is how we achieve good results. Awesome, sir. Good, and we've already given some Valium, and we're just gonna wait 5 minutes. We're gonna wash, and then we're going to begin. I'm continuously looking at the hairline to make sure that it's framing the face well, is natural, is age appropriate, but importantly, that is not symmetric. There's asymmetry and the zigzag pattern, so it looks natural. Have it 20, please. I like it. It's really good. And I spent hours really just looking and fine-tuning, making sure the asymmetry, the zigzag patterns, the naturalness, these are the most important, because I see a lot of work and a lot of stuff that I see is very symmetric on the face, and it does not look natural. So it's on the exact same plane. So we got 324 singles for the hairline. We got 1,172s and 623s. This is really important. So this 623s, that's over 1,800 hairs just from the threes. And this is the reason why I do the punching, and I use my special punches so I could capture a lot of these threes. So you could get good quality thickness. Obviously, you pay per graft, so the more threes you get, the better results you're going to get, and you're paying less, number one. And second, just get better quality results, because you have a lot of threes, very minimal ones. This is number ones we need to create the hairline. Anyways, and as I'm creating the actual slits, we keep track of the number of how many 2s and 3s we make, and the numbers match. So we'll have 1790 2s and 3s. I made 1,700 slits. We're going to go back again at the end of the day and fill in those 90s. So perfect. So, and these keep tracking, these housekeeping are very important.
So just finished up. I will not lie, it is a long day, but it's honestly not as bad as I thought it was going to be. The pain levels were monitored constantly and almost non-existent throughout the entire day. You're just kind of tired at the end because you've been sitting here going through the entire process. They do a very good job of keeping you occupied. I've been watching Netflix for the last 3 hours, so all in all, not bad at all. And super excited about the results going forward.